name's Anne Barwell. I'm 75 years old and I'm on warfarin because I have episodes of AF, atrial fibrillation. Quite considerable, I think, because you have to watch your diet, your alcohol intake, your medication. If you have to go on antibiotics, it's going to alter it, and certainly with analgesia, you're quite limited. Really, paracetamol is about the only thing you can take, or maybe codeine. And there are quite a lot of other tablets and things that react with the warfarin. Well, it's just very convenient, isn't it? I can do my test in the morning, the result goes through to my surgery, and then my week, or however many weeks it's going to be, comes back, and I don't have to go into the surgery. Don't have to worry about parking the car. It makes a big difference with travelling, yes, particularly if we do quite a lot of long haul travel, and that does help enormously because I can now send my results through to the practice, because again with travelling I think it does alter your INR, and also if you're going to an area where you have to take antimalarials, the Malarone or one of those sort of things, that again alters your INR, and I have noticed that when we've travelled that my INR has changed quite a bit, so this will be much easier when we go away shortly. I think it's a wonderful thing for them to be able to do. Once you get used to using the machine, providing you don't mind stabbing yourself, it just makes life so much easier.
I'm Les Saunders, I'm 58, I'm taking warfarin mostly because I've got AF, but I've also got left bundle branch block with a pacemaker. It means I've got a regular blood test, but remember to take tablets every day. I also have to be a little bit more aware, I can bleed. Just some of the activities I do, I should just be a bit more aware of. It's just given me the freedom of not to be tied to a clinic and come in every so often for a test. I can be away, I'll go away to France, and I'm not got to worry about it. It's been fine, it's been very easy. Once we've got it on the iPad, it's just very easy. The videos were fine, and then we finished off the last little bit on my last blood test in clinic with Bernie. It's just given me the freedom not to be tied to a clinic. Well, as long as you're okay using a computer or a phone, it's fine, just do it.
William Arthur Keithley, 61. I'm taking warfarin because I've got a prosthetic heart valve. None, to be honest. I just have to be a little bit careful, really, of certain, not to drink too much and things like that. But basically, if you act right with everything, as long as you're honest with your practitioner and everything about what your lifestyle is, then your warfarin can be sorted out to suit so that you can always stay within your target range by ordering your dose. That's how I do it. It's not really had a chance to impact fully, but the impact that it's going to have is immeasurable because of the lifestyle that we've chosen to adopt. So from that point of view, you know, it's probably one of the best things I've ever been given. So, to be fair. Fine, we've managed to go through all the setups and everything, and the machine's straightforward and easy to use, so all things considered, I'm very happy with it. Well, I'm not a techie person, and so I tend to sort of I'm one of these people who throws away the instructions and tries to do it himself. But with the help from Deborah, we did manage to get it all working properly without too many problems. I think if I'd have been slightly less impetuous, it would have been easier. So I think the training modules that are there are understandable for anybody that's got the patience to take the trouble to understand them, should I say. Just again, that's down to me. But yeah, I'm happy with the process, really. Do it, definitely. It just saves all the trailing around and everything else. I mean, coming down here for me is a massive issue because I live locally. But previous to that, I used to have to get tested at the local hospital, which is a few miles away, and they did it with needles, which is not overly pleasant when you're having to go like every month, and you feel as though your bruises are just about finished healing and you go again. Whereas this method is obviously far superior in every way. It's less injurious to you and much more convenient. Purely that just made everything so much simpler. Simple.